4, 3, we are live.
Good evening, friends. Welcome to this 4th edition of the BOS Foundation Day. As you all are aware, we celebrate this 14th of January every year as the day when this iconic organization was born. And to commemorate this occasion, we have a very, very interesting and pertinent webinar for all of us today on a topic which is very, very important for us to understand and execute in our day-to-day practice. That is how to connect better with our patients and how to develop a rapport with them so that we can have a practice which is gratifying, long-lasting, and sustainable. I request Dr. Tushar Agrawal, who has been extremely helpful to set up this event today, to introduce our speakers and set the ball rolling. Over to you, Dr. Tushar.
Yeah, thanks, Satish, and thanks all the people whom you see on the screen, our President, Rajesh Gandhi, sir, Neeraj, Bijlani, our Secretary, without whose without the opportunity which they provide, we can never bring about these programs. So today's program comes from a couple of thoughts which come into our regular practice. Quickly, so you are running a place of your own. A person meets with an accident, the relatives bring the patient into you. You know this patient requires a detailed evaluation, some operative management, but they're completely unknown to you. They're strangers. They have no rapport with you. So how do we build this rapport acutely with these people so that we can offer our services successfully to these patients? Similarly, lots of us see patients for like 3, 4, 5, 7 years with knee pain. And ultimately, we would come to know that they have gone for total knee replacement elsewhere. So we may say something which may break our rapport with these patients. So how to prevent breaking a rapport with a patient? Thirdly, we all encounter very difficult daily life situations, like maybe a relative causing ruckus due to a billing issue or facing some unforeseen mortality or morbidity in the operation theater. Our state of mind changes, but our day-to-day functioning, our indoor patient rounds and our 30, 40, 50 patient OPD remains to be seen. So how to make a sudden state, how to bring about a sudden change in our state? So today, what we will try to learn that is, does these things just happen naturally or is there a science to it? Can it be learned scientifically? Can we break it down into step 1, 2, 3, 4, 5? If we execute these 5 steps, we will be relatively and more successful in our day-to-day practice. So today I have my very dear friend Nitika. I have been knowing her like for the past 2 to 3 years. And we have a great mutual interest in neuro-linguistic programming and kids. Because I do pediatric orthopedics, I tend to encounter children with a lot of special needs. So she is a person who's certified in remedial education and language trainer for kids. She also does what is called a social panorama practice. So which means that how do we respond to the people around us in a favorable manner? And none other than her own trainer, Amit ji, is there with us, whom Nitika ji will introduce in greater detail. And one great thing she told me, the difference between a trainer and a coach, she says, you can treat patients, but you don't create orthopedic surgeons. So the trainer creates the coaches and the coaches treat the client. So she will introduce Amit ji, and then after that, Amit ji will take his talk, and then we'll try to keep it interactive. Dr. Abhijit Kale has also joined us. Welcome, Dr. Abhijit. Nitika ji, please introduce Amit ji.
Yes, I will first introduce Amit Pathak sir. So Amit, I've known Amit Pathak sir from around 5 years. He's one of the very few licensed NLP trainers in India, and he's having 23 years of experience. He is the author of 2 books, 2 best-selling books, and I have followed them out to the core and got amazing results. He's using science in business, coaching, and therapy work. He has written numerous articles on self-help and psychology and has appeared in TV shows, featured in news articles for his innovative and research-oriented developments in his field. This is all about Amit Pathak sir here. I have whatever knowledge I have today is also about what I have been coached by him. So as I rightfully said, that he has taught me how to cure people. He's not taught me how to train people to do NLP. That he does. Okay, and that is why he is here with us today on the platform, that he will be in a better position than me to explain how exactly the science works. I know how it works and I know the application, but the science behind it, he is the perfect person for it.
Wonderful. Amit ji, we welcome on behalf of Bombay Orthopaedic Society. It is really a pleasure to do this program, and thanks a lot for joining, and thanks a lot for all the Bombay Orthopaedic Society to really give us this platform.
Thank you very much. It's an honor and a pleasure. Really delighted to be a part of this esteemed community and getting a chance to speak here.
Yeah,
Thank you
Amit
very
ji,
much.
I must tell you, through Bombay Orthopaedic Society, we reach out to 3,000 orthopedic surgeons, and through OrthoTV, the message goes to almost 30,000 orthopedic surgeons across the globe. So I'm sure sooner or later, all our colleagues will be seeing this program.
Thank you very much. So maybe Nitika, you can start.
Yes. So basically, so let me start with what is NLP. NLP is the full form of NLP is neuro-linguistic programming. How our brain functions, how we use language, and then what outcomes we have produced through our learnings is what NLP is all about. NLP is actually changing someone's thoughts or behaviors to achieve certain desired outcomes. Basically, I term it up as we can use it for changing beliefs or habits. It is very useful in developing rapport, which is the topic of today. It is also used in achieving goals, removing certain fears or phobias which are inbuilt and they don't hold any value, but for us, they are a very big thing. They are also NLP is also used in treating anxiety and handling depression. And what I personally feel is it is helped me a lot in improving my work performance overall and also for personal happiness. So basically, when we talk about NLP, or very commonly used terms are the swish model or anchoring or modeling. ये सब चीजें हम सुनते रहते हैं. ये सब बहुत hyped terms of NLP है. And we use these and many more techniques to treat people and help them out with a certain thing which they have built up in their head. So it is all about how we are thinking. Basic 3 types of learning, what I will say all of us have are VAK, which is video, audio, and kinesthetic, which we are all aware of. Now, what NLP says, because of all these things, what we learn, okay, we develop another 4th, a very important learning style, which is called the AD, or the auditory digital. Okay, terming up all of this, VAK AD is termed up into, I will say, NLP learning and how the models are created and how we can actually help a person get what he really wants subconsciously. Okay, we want to, for example, if I'm talking, we want to even be aware of कि अच्छा यहाँ therapy work होके चला भी गया. So that is how NLP magic it is. And the most beauty of NLP, what I have liked into the 2 points are, first is it is a little content free. Suppose if I have a fear, मुझे जाके किसी को पूरा वो fear explain नहीं करना है. The first very basic thing कि सब कुछ क्या हुआ है, क्योंकि मैं कितनी भी story बताने जाऊंगी वो होगा नहीं. So it is a little content free. The first very important thing which I personally like. And second, it is very fast. We don't have to wait for 6 months of counseling तब जाके हमारा depression clear होगा या हमारा state of mind clear होगा. It will be very fast in like in 10-15 seconds or 10-15 minutes. A therapy work can be done, and I see that every day when I do it with my students around. I deal with very young as young as 3 years of age. तो उनको तो ये भी नहीं बोल सकते आंख बंद करो, बोलेंगे मैम डर लगता है. So how language can be used here and it works. So
just a second. So
Sure.
what has happened is, for the benefit of people who are not listening to these terminologies every day. Okay, so this is not mumbo jumbo, means it is scientific, and over the last 50 to 70 years, it's well established and used in every school of business. And you will find that many business writers or many productivity writers, without using the word NLP, are writing about the same thing. So it is a software for the brain, right? So we are going to give now, Amitji will tell us the software for the brain. So we have a certain brain software which we already have, which we have built up or which we were born with, which we are using in our day-to-day practice. So what Amitji is going to tell us is that how suddenly we can learn to use a different software altogether, right? And Amitji will also in greater detail probably explain this visual, auditory and kinesthetic, which probably my colleagues, senior and my colleagues here will not immediately be able to, get a rapport to.
Yes, sure. So Nitika, I think, did you want to mention any other point or should I start?
No, sir, you can take over. Thank you so much. Yes.
Okay, so first of all, once again, thank you very much for giving me this opportunity, and it's an extreme happiness and honor to be amongst all of you, really respected personalities. One request which I have from all of you is if you can switch on your videos if that's feasible, because we are going to make this interactive. So I would be happy to hear from you as we continue with this discussion. I just want to tell you a few things about myself. I have been in this field for 23 years, and during this period, I have not only learned this science from various dignitaries and specialists in this area, but I have also invented and researched my own methods and concepts and techniques. And I am using all of this to work on all kinds of issues that people have. Now, I'm not going to spend time or bore you with all the issues, but I just want to touch on one point, which perhaps I might feel that you might also agree, is that barring, of course, the orthopedic issues that patients come with, but there are many other challenges that people go through, which are psychosomatic in origin. Chronic stomach pain or any other such challenges, acidity, the acid reflux, they are all psychosomatic, and I work on many of those cases, addictions, fear, phobias, and allergies. I find that they are all solvable issues because they are associated with the mind. To kind of summarize, I work with the mind. I have methods and techniques which are very powerful in reading people's minds and then in reprogramming their mind so that they can actually live a much more fruitful and powerful and resourceful life, achieve goals, get out of issues that are bothering them physically or mentally in their life. There is a whole range of things that I do in this area. Today, as I'm sitting here talking to all of you esteemed people, I just want to say that there are enormous applications of this powerful mind programming science in your field. And what I'm going to touch on today is one area, which is rapport building. Few years back, I remember I was writing one article, and the article started like this, that if a person has a problem, whatever problem they are going through, whether it is a dental problem or whether it is a stomach problem, and they have a choice, they can go to a doctor who is right opposite side of the road in a building, but who is very rude. Maybe he is knowledgeable, but he is very rude. And they could go to a doctor who is 2 kilometers away, but who is very polite, friendly, and warm. Where would they prefer to go first? And normally, unless, of course, the doctor is absolutely outstanding and he has got tremendous reviews, positive reviews, then one might still decide that I will tolerate going to a rude doctor, but at least my problem will go away. Unless that kind of a situation happens, 99% of the time, the person may prefer to go 2 kilometers away to the doctor who is very nice, warm, and polite, simply because there is something called experience of treatment. What is the experience of treatment? In corporate world, if you go to businesses, you will hear this buzzword called customer experience. And every company nowadays talks about improving their customer experience. Well, if you now translate the same thing into the field of medicine, then it is the patient experience. And while you could have very beautiful hospitals or treatment centers, ultimately it is how the interaction happens with the medical practitioner and the doctor that defines the patient experience. You might even hear, sorry that you are all doctors, but as human beings, you will even hear somebody saying that so and so is a great doctor, but the way they talk doesn't make me feel very happy. And that is, I don't know whether you will take this as a compliment or whether it is a area of improvement. So I kind of, I'm going to talk about something around that area, which is about how to change the experience of a patient using the mind programming techniques of NLP. Of course, the other topic that I'm very keen to talk about is the state control, which is how do you keep your mind in the right state. Now, to tell you something, all you esteemed people, about the state mind power of or the importance of mental state will not be appropriate for me. But I would still like to mention that everything that you achieve, everything that you perform has got some connection with your mental state. And if you are in the right mental state, you get the best results. If you are not in the right mental state, then the results are not as good as what you would want. And usually people feel that the mental state that they are in is because of circumstances and factors outside of them, which is absolutely wrong. The mental state that we are all in is because of how we perceive the factors and situations outside us. And that's in our hand and in our control. How do we want to perceive it? So I'm going to talk a little bit about that and show you techniques on how to achieve that. Now, before I go into all of this, I want to ask you something. So I want this to be interactive and I want you to participate with me. All right. Sometime back, Nitika mentioned about visual, auditory, kinesthetic, and something more called AD. I'm not going to kind of get into those details now, but I'm going to ask you something very simple. Okay. Can you tell me, anyone can volunteer, but I would like more of you to volunteer. Can you tell me something about, let's say, a recent medical conference that you attended? And how did you, I don't want to know the details of the event. So don't tell me where it happened, what was the name of the event, etc. But how did you find the event? Did you find it great? Did you find it average, boring? If so, why? Can anyone want to volunteer that? That's option number one. Let me give you option number two. Option number two is, can you tell me, describe your mobile phone to me? How, if you had to tell me something about your phone, how would you describe? What would you say about your phone? Anything that comes to your mind? Anyone wants to volunteer?
Well, when it comes to mobile, one likes their mobile. It's like their wife. वो प्रेज करते हैं हमेशा, सबके सामने प्रेज करते हैं. बाद में प्राइवेट में दे विल से, ओ साला इसमें डिफेक्ट है, दूसरे का अच्छा है यार. Neeraj is the latest mobile phone. I don't have a latest mobile phone, something of that sort, And I'm very truthful about this. People envy Neeraj for that. He buys mobile every year. He buys new gadgets. So that is one thing.
But he's gadget guru of Bombay Orthopaedic Society, so he has to buy.
Okay, great.
And about the event which we have attended, where it was a grand and great event. Thank you.
So event तो ऐसा है कि गांधी sir was the president, so he was organizing. So sir, मैं बोलता हूँ. So the venue was great. It was a huge venue. It felt मतलब great to be in such a huge venue. And the academic discussions were way beyond what was happening before. And it was very comprehensive and very complete.
Brilliant.
So now with that, what will you understand. If
I will tell you in a bit, but we'll just move around. Maybe Neeraj
So
sir,
Neeraj will tell us about his mobile.
he can talk about anything, sir. No pressure. But
No. So basically, mobile is something which is so close to me that a few years back, before the lockdown, when we went on a vacation, my daughter told me that you should start a YouTube channel called Phones and Bones. So I always, it's like you can say that it's like an addiction that whenever the new iPhone comes, I have to buy it. Earlier, I used to be struggling to buy the first one, but now I'm become a little intelligent because I have to buy it every year. I see to it that buy it from the cheapest country possible. So I always keep friends in US now, but because now US came out with some eSIM version, I have to keep friends in UK, Australia, Europe, everywhere. So one of them has to bring me the mobiles. This year it came from Australia.
so if you had to describe your mobile in let's say 3-4 sentences, how would you describe it?
So my iPhone is the best camera that I have, and it is the fastest phone. And I can say that it is very difficult to live without it.
All right, great. Okay, fine. One more we'll probably take from somebody else who is there in this forum.
Satish ji,
Yes.
how will you
Yes, sir.
describe your mobile?
Who did you ask that?
Mutha ji, Dr. Satish Mutha.
Okay,
Yeah.
sir.
How will you describe your mobile?
So I am not as tech savvy as Neeraj or Tushar, but for me, the single most important thing is how user friendly it is. It has to be very user friendly, should allow me some level of multitasking, good battery life, and I don't need high fun-touching. Same with the conference that we had, if you ask for an opinion. I think the best thing in a conference is how easily it allows you to access all the information that it is providing, and how easily it allows you to network with your friends whom you're meeting maybe once or twice a year. These two things can actually overshadow the venue and the food and all the other things.
Fantastic.
तो सर
Great.
अभी आप सस्पेंस ब्रेक करो, अभी आप बताओ.
Okay. So see, what happens is in your language, there is a secret which is hidden about the way you take information from the outside world and the way you store and process that information from the outside world. Now, all of us have three different ways to take in information from the outside world. One is what we see, which is visual. Another is what we hear, which is audio. And the third is what we feel as in sense, the touch, etc., which is called as kinesthetic. And once we take in all this information from the outside world, we decide what to keep, we decide what to throw out, we decide how to keep it, how to connect it with information that we already have, and make meanings and ideas around it. And that is called as our fourth channel, which is called the analytical channel, also known as AD. So essentially, we take information from the outside world on one of these or more than one of these four channels. What it really means is that some of us are mainly visual people. We take information from the outside world visually. We remember what we see. We make pictures in our mind of everything that we see. Some of us are audio people. We kind of listen to people and what they say, their tone of voice, how they say, the choice of words, etc., their language. The third one is kinesthetic. We are people who kind of connect with human beings, other people, through the way they touch us, the way they hold us, the way they feel the bonding, the physical, emotional bonding with the other person. And finally, there is a fourth category of people who are mainly thinkers. They like to compare, contrast, analyze, evaluate, and try to kind of build connections across different parameters. Now, from all that you described, about your conference or of the mobile phone, almost everyone brought up this tendency of being an analyst, being an analyzer. Now, this is not surprising to me at all, because doctors by profession are expected to be thinkers. because their job requires them, their work requires them to keep thinking, analyzing, evaluating, comparing, figuring out different connections, and then deciding the course of action. A very critical part of a doctor's role is decisions. Okay, and decisions make eventually what happens later on. The diagnosis, the treatment, everything happens based on decisions. So usually I will see that whenever I am talking to any doctor, I will usually find them to be analysts. Now, if you take the message that Dr. Satish Mutha gave, that Neeraj phone is better, Neeraj phone has this, that, and Neeraj phone does this. These are all comparison statements. So there is a sense of comparison between this and that. There is nothing right or wrong. So I want to clarify that there is nothing good or bad, but there is just a way of getting information from the outside world and processing it. Nobody ever told me that this phone looks good, this phone has a brighter display, this phone has much better colors and color combinations, and it looks very nice, etc., etc. If somebody had said that, then even Dr. Tushar, when he said the event, the conference was huge and it was grand, these are all languages of comparison, because you cannot say something is huge unless you have compared in your mind with something else. And maybe you didn't realize that there is a comparison, but there has to be a comparison for you to claim that something is huge or something is grand, right? So why is this important? The reason this is important is, if I know the way you take in information and what is your preferred style of processing that information, then I know what are your hot buttons, or in other words, what are your weaknesses, because that is the way you are dealing with information. And if I know that, then I know now how to use that to build rapport with someone. Say, for example, let me give you a contra. Let me give an opposite information. Now, if you look at let's say input given by Dr. Neeraj, that I like to take iPhones, new ones every year, and I look at price points, and then whether it is from US or Australia, and I do. If you notice this language, you would have figured out this is a language of comparisons and evaluations. Okay, so now if I were to actually tell Dr. Neeraj at some point in time that hey, I can get you a phone from Malaysia. Malaysia phone is very good looking, very jazzy, very beautiful. It has a metallic finish, etc. I guess his first question would be, what is the price point? What are the features and functionalities? And is that going to be something of value to me? And if I keep telling him, but forget the price, forget the features, the phone looks amazing, he might be switched off. He might say, well, but I don't care. I am looking for something else, A, B, C, D, E, give me that. Then I'll decide whether it is worth my time or not. Correct? So a easy way to switch him off in my conversation is to give him information which is not in his style of taking information. Okay. So if he is someone who has a tendency to compare, contrast, evaluate, then the best way to draw his attention by me is to give him that comparison, contrast, evaluations, which will feed into his thought process in a very nice way, and he will feel this is exactly how I wanted this information. And if I keep doing that again and again with him, I bet over a period of time, he will feel I understand him best. Others don't understand him because I give him the information in the way he loves to have it, right? So this is the first secret sauce for rapport building. What you need to know is listen to the patient's language. The language of a patient is very clearly telling us, just as I read from your language, what is their preferred style of taking information. Some patients are visual, mainly. Now let me clarify this. When I say visual, it doesn't mean they don't take information from other channels. It doesn't mean they don't hear or they don't feel anything. They don't analyze. It only means that a large proportion of their way of functioning is visual. They take in what they see. Now, if that is the case, the first thing that will happen when you go and meet the patient is they look at you and they make a decision. Okay, whether you are the right doctor for their treatment. Okay, so how do you look? Now, when I say look, I don't mean you should wear some beautiful clothes, etc. It is the expressions on your face, right? Are you walking in with an expression of confidence and let's say a smile? Okay, that's the decision maker for them, and everything else is gone afterwards, right? If you might have come across, and I'm sure you are all very experienced doctors, you might have come across that there are patients who will say, sir, one look at you and I felt you are the right doctor for me, right? And then I did not even notice the price points or the cost or anything. I felt that bonding with you when I looked at you, and the way I saw you, I felt you are the right person for me, for my treatment, correct? And you will have come across contra cases also where somebody might say, but you know what, the way the doctor looks, I'm not feeling very comfortable. So these are called visual rapport building. Now comes the auditory rapport building. So some people are very good listeners. They notice the smallest change in the tone of your voice, the choice of your words, the way you talk, okay, the softness or the loudness of your voice. And they're very sensitive to that. Now, how do you find out all of this? The way you find out is there are many signals that they give. If I ask somebody, for example, and I'm just making this up as an illustration. If I ask somebody, how was your holiday? And if they use a language which paints a picture. For example, if they say it was beautiful, beautiful beaches and very nice bright palm trees, and the hotel was very nicely lit up, everything was looking so beautiful, from the language, this person is visual. But if you ask some other person, how was your holiday? And if they say, the best thing about the holiday, no sounds of the city. Everything was peaceful and quiet. The only sounds you were hearing were the sounds of the sea waves and the wind rushing through the trees. And I could just play some light music and relax. Now this person is mainly an auditory person. Whereas if you ask some other person, how was your holiday? And if they say, the best thing was the relaxing atmosphere. It was so relaxing, so comfortable. You could actually feel the nice cool breeze and the peaceful energy around. This person is a kinesthetic person. They are actually connected to the energies and the comfort, okay? And if you ask the fourth person, the thinker or the evaluator, like most of you over here, is how was the holiday? And you will have a tendency to compare. So, it was amazing holiday, very comfortable. Everything was nicely organized. The locations were amazing. So there is nothing that comes out as visual or nothing as what you heard or nothing as what you felt. It is all about comparison. The organization was amazing. The location was great. It all shows you have a tendency to compare. Now, how does that matter to you? When you are meeting a visual patient, and if you are going to talk in a if you are going to have the right expressions and the right way of standing, walking, they are actually able to see your confidence. Let me repeat, they are able to see your confidence. Okay. And that's what they are going to see. When you talk to an auditory person, they are not seeing, but they are listening to you. How is your tone of voice? Okay. You might say to somebody something that is not positive. Okay. Let's say you might say there is a major surgery required and it's a very, very major process involved, etc., etc. But the way you say it makes a difference to the listener. Do you agree with me? Right? And that way of saying is what matters to the auditory person. The tone of voice. How are you talking? Loudly, softly, fast, slow, etc. Finally comes the kinesthetic patient. They are more about the sensations of touch. Okay. If you were to just put a hand on their shoulder and say everything will be fine, that's it. They want only that, because that touch gives them the assurance. Or if you shake their hands, the way you shake the hand gives them a feeling that this is something nice and warm. Okay. So this the comfort, the atmosphere in which you are calling the meeting, where are you calling your patient and where are you meeting them? That atmosphere makes a difference to the kinesthetic person. Finally, the AD. The AD person is an analyst or an evaluator. If you were to give them all the information, the points of comparison, then they will begin to, and you give them the information. You must have come across such patients, right, who ask you a lot of questions, right? ये कैसे होगा, कब होगा, ये करेंगे तो क्या होगा, ये नहीं करेंगे तो क्या होगा, मेरे पास options क्या है, अगर ये option नहीं लिया तो क्या होगा, right? They are the people who like to analyze. If you don't give them the analysis and the comparisons and the information about that, you have lost them. Now, all of this seems like, oh, itna sara, but it is not so difficult. It is just a very, very simple process of listening to their language. If you listen to their language, you know what is their style. If they ask you 25 questions, you know this is an analysis person. They like to compare, evaluate. Now, why does this matter? The reason this matters is to handle objections or to handle resistance. Suppose if you know that this patient is someone who likes a lot of information, then instead of waiting for them to give, if you start giving them information which are data points or information points and comparisons, etc., they will feel they are in safe hands. They will feel they are in the right with the right doctor for the right treatment, because you have given them information before they ask in the format in which they love to have information. However, if you give this kind of detailed comparison to a visual person, that person will feel scared. That patient will feel, इतना सारा मैं कैसे ध्यान रखूंगा, डॉक्टर तो कह रहे थे ये भी करना है, फिर इसके बाद ये होगा, अगर ये होगा तो ये भी करना पड़ेगा, वो होगा तो ये भी करना पड़ेगा. Sorry, this seems too much. Something is wrong, because you are actually talking to a visual person, a lot of analytical information or data information. So there, if you were to just give them a visual picture, look, this is what we are going to do, and this is what it will look like, the final picture, and this is how we are going to do it. That's it. Trust us. They will feel this doctor is the right person for me. I love it. This is how I would like to go for it. So in the end, if you actually think about the process of rapport building, it is just 3 steps. One is, educate, give information to the patients in the format in which they can process the information. Second is motivate. Motivation is from the way you look or the way you talk, the tone of your voice or the way you shake hands. Okay. And finally, activate. Activate means now tell them, okay, so what do you want to do? How do you want to go ahead? Is this information good enough? Etc. So this is my first kind of piece of information on rapport building. Any questions? I'll take a pause, check if you have any questions.
Sir, I think the biggest struggle is to actually understand whether my patient or relative is visual, auditory, kinesthetic, or digital. I think we all will agree with you totally, because sometimes we'll tell them कि for knee pain आप दूरबीन का भी ऑपरेशन करवा सकते हैं, आप अलाइनमेंट चेंज हम हाई टिबियल ऑस्टोटोमी भी कर सकते हैं, यूकेआर भी कर सकते हैं और टीकेआर भी कर सकते हैं. दिस इज द मोस्ट कॉमन डिबेट which is going on in orthopedic circles. तो some people may like this information और दूसरा आदमी बोलेगा आप चिंता नहीं करें, मेरे ऊपर छोड़ दो, मैं एकदम परफेक्ट करके देता हूँ आपको. But how to understand which is better?
Right. So,
but what are the key questions that we can ask the patient and the relative for us to quickly come to a conclusion कि बॉस ये थोड़ा visual है या ये digital?
Good. So, देखिए, you don't even need to, first of all, you don't even need to ask questions. There are many other signals that you can look at. Okay. Visual people, if you listen to their language, it will be more like, they want to see things. बताओ ना क्या है, मुझे ये बताओ, रिपोर्ट बताओ, मेरा एक्सरे बताओ, मुझे मेरा सोनोग्राफी या जो भी आपने किया है उसका बताओ. He will talk about बताओ, show me this, show me that. Okay. Second is, the visual people, if you ever look at them when they are talking or thinking, they tend to look up. Okay. So you will find them looking up when they are trying to make up something. The reason they look up is when you look up, you are making up pictures in your mind. Okay, so whatever you are explaining, they are making pictures in their mind, and that's why they tend to look up. Visual people, their dress sense will also be nice, color combination, istri wala shirt, all of that. Whereas all other people will not care what they are wearing. Okay, so you will find, have you come across some doctors who are very particular about their appearance? Okay, they will wear tie and they will wear the coat, and they are very particular about how they look in front of their patients. Have you come across such doctors?
Yeah, for sure. Yes.
Right. So these tend to be visual doctors.
Yes.
Okay. They are very particular about their looks. Same way with visual patients. They are very particular about their appearance and looks and all. Auditory people, they tend to be either very good listeners or very good talkers. Either of the two. So if you find somebody talking a lot or listening a lot, very quiet, you can be sure they are mainly auditory people. Okay. Auditory people have a tendency to look away from you while you are speaking. So, you as a doctor, when you are talking to a patient, you like your patients to look at you. But you will find that some patients are looking sideways while you are talking. It's not because they don't like what you are saying. It's because they want their ears to be closer to you while you are talking. Third is kinesthetic. Kinesthetic people are more sensitive to ambience and comfort and the environment. They are also wearing clothes which are very comfortable for them. They are not worried about looks. When they are sitting in a hospital or when they are sitting on a bed or something, they are more worried about how the whole thing, energy feels like. Okay. So you will come to know from their signals. They like to kind of, shake your hand, or they would like to kind of, hold your hand like this or whatever, to give that feeling of trust or confidence. So they like to do that. Or they may not hold your hand, but they are holding hand of a relative. Okay. So you will know that these are kinesthetic. And AD people, they tend to ask a lot of questions, and they will not even allow you to complete your sentence. So by the time you are saying something, they are on to their next question. You might have come across such patients also, right? क्या आपको ही बोलने नहीं दे रहे हैं और उनका नेक्स्ट क्वेश्चन शुरू हो रहा है. So when you come across such, this is a person who is an AD or a digital person. They like to analyze a lot. Okay.
Sir, if I may just ask, I feel from your conversation that most of our patients are a mixture of all.
Yes. So
should we try to learn to represent our information in all these 4 formats to all our patients?
Absolutely right. So when you don't know for sure what kind of a channel or what kind of a way your patient is taking information, you have to kind of spread out and be sure that you are covering all of them until you become sure that this is how the patient is normally taking information. अच्छा, एक और चीज इसमें ध्यान में रखना जरूरी है. Rapport need not be with the patient alone. Rapport could be needed with the relative of the patient who is going to take the decision on behalf of the patient. Do you understand my point?
Absolutely.
Because sometimes the patient may not be in a position or authority to take decisions. The decision is being taken by a relative, maybe the father of the patient or some brother or somebody.
So right at the beginning of my practice, I started my practice in pediatric orthopedics, and I was called upon to operate a basic fracture, supracondylar. And I went there to another hospital, and I explained everything to the patient's father. He had another relative accompanying him. So he listened to me and asked him, "To aur ab kya kare?" So, at that point of time, I was so junior, I got so wild. I said, "Aap unse kyun पूछ रहे? अगर आपको डिसीजन लेना है तो आप मुझसे कोई सीनियर डॉक्टर से पूछिए, ये कैसे बताएंगे आपको?" So he said के I don't want to take treatment from you because you are not respecting him, and for me he is what matters. ये जो बोलेंगे वही मैं करूँगा. So that way was educational to me to understand who is the influencer in these person's life.
Absolutely right.
And I have to be very, very respectful to the influencer no matter what happens.
Right. So I was doing my research in the morning today that what are the top questions that patients normally ask. And I found some 3, 4, 1. First one was, let me think about it and come back.
Yeah.
Okay. Whenever a patient says, let me think about it and come back, it means somewhere the rapport is broken. Okay, मतलब उसको doubt है mind में, कुछ तो doubt है. There is some resistance, some reservation. Okay, you must have come across such patients, right? No matter how much you explain, वो बोलेगा, let me think about it and come back. Okay. Second thing is, I need to discuss with my family and revert. Okay, which means the rapport has to be built with somebody else who is more of an important decision maker. Correct. Third is surgery the only solution? ये भी आया होगा आपके पास बहुत सारा.
Every day आता है. हाँ. Every day and every patient whom we advise surgery, they always ask.
Correct. Right. So this is third, and fourth is it going to be costly? Right. So I was just checking and I found these are the top questions that come up in most of these cases. Now, what I want to talk about is few ways to handle this from a language perspective. If you can permit me another few minutes.
Yes, please go ahead.
Okay. This is called as objection handling. And I want to show you something which is very interesting, and you will not find this information anywhere. Okay. One is called the power of the word but. Okay. The power of the word but is whatever you say after the word but is registered and imprinted in the listener's mind more than whatever you say before the word but. Okay. So suppose if you say to somebody that there are many ways to handle this. Can you put the questions in the chat box?
That's not for you, sir. That's not for you.
Okay. So suppose if you say to somebody that we will have to perform this particular surgery or this particular procedure, but I will have to figure out what are the right dates or appointments that I can consider. The patient will forget about the options of the procedures of the surgery, but he will be more worried and focused around the second part, what you said after the word but मेरा appointment देखना पड़ेगा, कब का कर सकते हैं. ठीक है. अगर आप उसको उल्टा बोलोगे, सपोज आप बोलोगे मुझे अपने डायरी में देखना पड़ेगा अपॉइंटमेंट्स कब का है, बट वी विल हैव टू डू दिस प्रोसीजर, देन द पेशेंट विल रिमेंबर दैट प्रोसीजर इंपॉर्टेंट है. डॉक्टर का अपॉइंटमेंट कभी भी मिले मगर प्रोसीजर करना जरूरी है. डू यू अंडरस्टैंड द डिफरेंस बिटवीन द टू? सपोज इफ यू से मेरे पास में 2-3 ऑप्शंस है बट हमको कॉस्ट फैक्टर देखना पड़ेगा, तो पेशेंट विल रजिस्टर द कॉस्ट फैक्टर फर्स्ट. इसमें कॉस्ट का इन्वॉल्वमेंट है, क्या कॉस्ट होगा, लेट मी थिंक. ओके, द ऑप्शंस दैट यू आर पॉसिबली गोइंग टू थिंक अबाउट ट्रीटमेंट, वो उसके माइंड से निकल जाएगा. मगर उल्टा बोलोगे कि कॉस्ट फैक्टर देखना पड़ेगा बट देयर आर मेनी ऑप्शंस अवेलेबल विच वी कैन लुक एट, द पेशेंट विल रजिस्टर दैट ऑप्शंस अवेलेबल है. अगर मैं आपके लैंग्वेज से छोड़ के एक सिंपल लैंग्वेज में बोलूँ, सपोज मैं आपको बोलूँ कि I want to lose weight, but I find it difficult to find time for exercising. तो mind is registering the second part, but के बाद मेरे पास में exercise करने का time नहीं है. अगर उसी को उल्टा बोल दे, I find it difficult to find time for exercising, but I want to lose weight. Where will your attention go? Okay, to the fact that you want to lose weight, right? Now, wherever the attention goes, that's where the person will begin to focus and their energies, right? So one thing that I would leave you with is be careful about what you put after the word but in your sentences, because whatever you put there is what will register in the patient's mind. Whatever you put before the word but will be dropped out from their attention. Okay? So anything that is related to what you wish to do, your goals, okay, positive outcomes, के इससे ये हो सकता है, इससे ये benefit मिल सकता है, इसमें आपको ये फायदा होगा, okay, that you put after the word but, because that will be registered. Anything that you put before the word but, you can put the challenges, you know, इसमें ये challenge हो सकता है या वो difficulty आ सकता है या जो भी आपको बोलना है, okay, that will not get registered. It's a proven experience of psychology. You can place anything that you are going through I want to open a new clinic, but I am finding it difficult to find investors. Where is your attention? Difficulty in finding investors. But suppose if you flip it, I am finding it difficult to find investors, but I want to open a new clinic. Then your mind is focused on wanting to open a new clinic. That is where the focus goes. So this is my first thing.
Sir, ये listener का focus बोल रहे हैं आप. The listener focuses on everything after the but.
Correct. When I say listener, you are also talking to yourself, right? All the time.
Okay.
And what are you talking to yourself?
So
right?
Our self-talk also matters a lot.
Absolutely.
Yeah.
Right. And typically our self-talk is structured like this. My goal, but my challenges. My goal is to reduce weight, but my challenge is I don't have time. My goal is to run 5 kilometers, but my challenge is my body doesn't support me. तो हमारा typical language ये होता है goal but challenge. Flip it. Challenge but goal.
Okay, so जैसे मेरे पास time नहीं है but I'm walking 5 kilometers every day. ऐसे बोल रहे हैं.
Yes. So the moment you say that.
और अगर ऐसे मैंने बोला कि मेरे पास 50 पेशेंट की ओपीडी है लेकिन यार आजकल टाइम ही नहीं है, सो मतलब गड़बड़ हो गया है.
राइट. तो आपका जो अच्छा चीज है वो बट के पहले डाल दिया.
तो मैं बहुत बिजी चल रहा हूँ लेकिन आजकल 50 पेशेंट की ओपीडी देख रहा हूँ. सो दैट इज द राइट वे ऑफ सेइंग.
करेक्ट. बिकॉज़ यू आर क्रिएटिंग अ वेरी पॉजिटिव स्टेटमेंट टू योरसेल्फ.
सर आई इंटरप्ट यू. एक बहुत इंटरेस्टिंग क्वेश्चन आया यहाँ पे. रैपो बिल्डिंग के लिए व्हाट शुड बी आवर मिनिमम टाइम वी शुड इन्वेस्ट इन द कंसल्टिंग. मतलब इस 5 minutes, 10 minutes, 15 minutes, कुछ आप बताएंगे कि what is an average scientific way in which we can actually understand?
So research says anywhere between 4 to 8 minutes. Okay. However, what I would like to say from my experience is that if you have 4 to 8 minutes, fantastic. But rapport building grows with increased number of meetings. So today, if I have met you for only 1 minute, okay, and then I meet you again after 4 or 5 days for another 4 minutes, and then I meet you again after 4 or 5 days for another 2 minutes, then every time the rapport keeps growing. So rapport is based on two things. One, the frequency in which you meet somebody, and two, whenever you meet, how much time you get, and during that time, how you are communicating, visual, auditory, kinesthetic, and AD. If you pick, so what I like to leave you with is, don't worry whether it is that you get 2 minutes or 5 minutes or 20 minutes. Let that be a parameter to keep aside. More important is, are you using visual, auditory, kinesthetic, or AD whenever you interact with somebody? Okay. That defines the quality of interaction. For example, sometimes it takes only 1 minute for you to reject a person. Okay. And sometimes it may take only 1 minute for you to like somebody. Right. And the reason why it is so is not because you got 1 minute or you got 5 minutes. It is because of the way you came across to that person.
Sir, Dr. Mutha is again asking whether it's a combination of visual, auditory, kinesthetic, and digital. So I think that you've already answered that most of us are. And to the
Absolutely.
best of our ability, we should try to use all. And then gradually, as we keep understanding our patient and their relatives, we can go ahead with more of a certain type as per how he asks us. कि अभी आप मेरे को एक्सरे में दिखाओ ना, मुझे फ्रैक्चर किधर है.
करेक्ट.
आप मेरे को कोई और पेशेंट का एक्सरे दिखा सकते हैं जिसको आपने ऐसे ऑपरेट किया है.
करेक्ट.
या सम पीपल विल आस्क, मैं किसी और से बात कर सकता हूं जिसका आपने जॉइंट रिप्लेसमेंट किया है.
करेक्ट.
So that will tell us actually what the patient really wants. So
Absolutely.
sir, I think we will come to one very important point जो मैंने आपको पहले पूछा था, is that how to suddenly develop acute rapport to a complete stranger.
Correct. So there are many methods, but my thought process is there is a technique.
जैसे आप सेमिनार करते हैं सर, है ना, and there are like this bunch of 1000 strangers in your room, and then they will join in a batch. So हमारे NLP coach बोलते थे the best way to increase your success rate is to increase your failure rate. मतलब you keep talking to more and more number of people, so ultimately you will be successful in doing certain number of.
Correct. So I will tell you one very different formula for this. Okay, and this formula is all about what in our psychology field we call as values. What is it that you value the most? Okay, safety, security, trust, comfort, or money, for example, right? What is it that you value the most? Every person, no matter who I talk to, will quickly tell me what is it that they value the most. For example, if I were to ask, let's say if I ask Dr. Neeraj, sir, what is it that you really find good about the iPhone? What answer would you give?
The smoothness it works within the camera.
Sorry, can you repeat?
The way it works, the way how it works smoothly, and the camera.
And what about the way of working smoothly and the camera is that you find so good about the iPhone and not other phones?
So when I'm trying to call someone, I can call in 2 seconds compared to any other Android phone, which it takes me 5 to 7 seconds. So my time is saved.
So
it is extremely fast.
Speed of response and time is very important for you.
Yes.
Right? Now I have come to know one value about him. And I can bet this must be there in many other areas of his life. Okay, the way people give respect to time and the speed of response. Okay, this is very important for him. Now, if I come to know about that and I have to now talk to him, then whenever I'm saying anything, and if it is to do with speed of response and time, that will become an immediate connect for him. So instantly he will feel, okay, this guy respects the way I like things. But let me tell you one thing, that values are, there are many values. So speed of response and time is important to him, but something could be even more important to him than time. Okay. So what is it that is more important to him than time? If I can come to know that by asking him, so what is it that is more important than time also? Suppose if something takes longer, okay, but yet you would like to do it, then what is it about that thing that you would like to do? And if whatever he answers, that becomes more important. So the point I'm trying to make here, Dr. Tushar, is that everyone has certain things that are very important to them. Okay. For example, it could be trust.
So
okay?
I can immediately answer that. जैसे अभी कोई fracture patient आया ना, तो at some places the relatives want you to operate that evening only. So many people will say हम अभी इसको ये तो भूखा पेट है, let's just operate within 2 hours. मैं अभी का भी operate करके दे देता हूँ. So there that is swiftness of action.
Correct. Now imagine in that scenario.
और दूसरे पेशेंट को क्या बोलेंगे, देखिए भूखा पेट नहीं है, हमको फिटनेस करनी पड़ेगी, सेफ्टी रखेंगे, सेफ रखकर हम करेंगे. So that patient will require safety and security.
Absolutely.
और थर्ड पेशेंट को हम क्या बोलेंगे, देखो आपका कहीं भी और बिल आएगा, शायद 1.5-2 लाख रुपए आएगा, हम आपको 70-80 हजार रुपए में करके दे देंगे. So for that person the value is money.
Money. Now what I'm trying to convey here is, if you give, let's say जिसको time की importance है, उसको आप बोलोगे कि नहीं 2 दिन के बाद आओ, what will happen?
No, they'll go away.
They will go away.
They'll go away.
Correct.
It has happened in trauma patients to all of us, you know.
Correct. So the thing is, you come to know what is, if you want to make instant rapport, the first thing you need to know is what is important to them. Okay. And if you can connect to that which is important to them.
And we have to match that value.
Yes. You have to match, or if you cannot match, what is more important than that? Okay. For example, let's say money could be an important value to somebody. Okay. But let's say, for example, whatever you are offering is not going to be in their budget. Okay. Then what is more important than money for them? Okay.
Safety and outcome. The
Correct.
Outcome and result.
It could be anything, but let's say, for example, some patients may say dependability and availability of the doctor is more important. Like, very recently, one of my relatives had some heart issue, and there was two options. One doctor who is very reputed, but he gives appointment after 1 month, and another doctor who we didn't know very well, but he is available all the time. Okay, so they decided कि ये डॉक्टर के पास जब भी जाना है जा सकेंगे, मगर उनके पास में तो एक बार जाएंगे फिर प्रॉब्लम होगा तो 1 महीना और वेट करना पड़ेगा, तो बेटर टू गो टू दिस डॉक्टर. So availability and that feeling of safety that I can go whenever I want, that could be more important than money. Okay, so now suppose if you come to know that, then what should be the way you present, right? You might say that, look, this may cost you more, but I'm always available. Whenever you want, you can reach me, and I'll be happy to look again. और ये जो situations होती है, ये जो treatments होती है, इसमें बाद में आकर मिलना भी जरूरी होता है, बाद में चेकअप भी करना जरूरी होता है, और वो उस टाइम पे if there is any complication, any questions, I am available. That may decide कि यार even if this is more expensive, I will go with this doctor because this doctor is available to me. It is more important than money. So you have to find out what even if they have there is something that you cannot meet because of your challenges, then what is it more important than that which you can connect to, and then talk about that, and then they will feel this is the right person for me, this is the right doctor for me.
So what is their value, and what is their, I think also what are their pain points and how to instantly solve them?
Absolutely. So value and pain points are pretty much interrelated, right? Because all our decisions happen based on our pain points, which are nothing but our values. So there are two kinds of values. One, something that we don't want and we are running away from, and something that we want and we are going towards that. So I want trust, and I will go towards a doctor who gives me that trust. And I want to go away from someone who is not available to me all the time. Okay. So it could be either of the two. Which one is more important to me?
So that is also a type of personality. Those who are who want pain or gain type of personality.
Absolutely right. Absolutely. So,
sir, we are sort of running out of our time, but quickly, sir, quick state change. So we have already discussed that we come across in our day-to-day practice that some sort of an unforeseen disaster has just occurred, or some major communication lapse has just occurred, which has completely disarrayed our personality. And very quickly, we want to rebalance our state and immediately start delivering services in our hospital or in our practice. So is there a quick tip that how, by the help of neuro-linguistic programming, we can, utilize that and make ourselves into a more pleasing personality again?
Correct. So
we'll give him an example. I think, Tushar, we should give him an example like we were talking before. Why don't you give him a direct example? It will be better for him to judge.
So, sir, ये दो example हमारे साथ commonly होता है. We are operating, and in the OT some disaster has happened for no rhyme or reason. And now to solve that problem, it took us 2 hours to counsel relatives, patient, shift the patient to ICU. So that has completely disarrayed the whole system. And you are feeling like abhi mere ko ye OPD cancel karna hai. But there are 30 people who are already sitting there waiting for you. And the second example which commonly happens is the patient comes down and he fights over the bill of some of his patient in front of all the relatives, and it creates such a disharmony in that whole situation. So now when everything has gone disarrayed and now you want to control this situation and now present yourself in a nice reinforced manner. So how will you do that?
Correct. So in NLP, we have a concept or a topic which is called anchors. And it is a topic where you actually learn how to program your mind to instantly switch into a desired mental state. So first you install or you kind of implement that software in your mind. So once you install that software, you actually kind of figure out a technique or a method by which you kind of, install a desired mental state. Now, when I say desired mental state, it could be anything. For example, a state of feeling very calm and relaxed, or a state of absolute focus and concentration. Because when you are performing your surgeries, you probably want to feel very focused and in concentration. So you can first decide what kind of a state you wish to have. Then the second step is you come up with in your mind any reference experience, any experience where you went through that mental state very strongly. For example, if you say, I want to learn how to teach myself to be absolutely calm whenever I want, then can you think of some event, activity where you felt this feeling of calmness very strongly, very, very strongly, unconditionally calmness? No matter even if there is a bomb blast happening next door, your mind will stay calm. What is it that you do which makes you feel absolutely calm? Once you actually figure that out, get into that event as if it is happening right now and feel that feeling of calmness going through your entire body. Then you amplify it. Amplify it is done by various ways. For example, imagine that feeling as a color and you have that color all over and around your body. Imagine that feeling as a temperature and you feel that temperature around your body. Imagine you are covered in a bubble of light, which is having a color of that color of calmness. Once you amplify it, then you just lock that state somewhere in some place in your body. The way to lock it is you could just snap your finger or you can tap your knuckle, something like that. Okay, do some movement or some touch which connects to that color, that feeling in your body. Once you have done that, it is locked. Now, next time, if you just tap it, if you just tap yourself or you snap your finger exactly the way you had done it initially, you will instantly feel that calmness and that color and that state in your body. The key here is to repeat it and practice it. So the more times you repeat and practice it, the more stronger that feeling will become and it will stay with you forever. Then the next thing is how to use it. So imagine you are actually coming into a situation where you want to experience that feeling of calmness. All you need to do is just start tapping the way you installed it or snapping the way you installed it. You will instantly feel that feeling rushing through your body and you will feel absolutely relaxed. It will change your breathing. It will change your mental construct and you will feel absolutely relaxed. You can install like this every different state. So, you can have one knuckle where you are installing calmness. You could have another knuckle where you are installing focus. If when you want to focus, just press this and you will feel the energy of focus inside your body. This is the simplest form of explaining how anchors work. If you try it, I promise you, you will say, boss, this somehow it works. I don't know why, but it works. And it instantly gets me into that state. And that's how, if you practice this concept, it will give you enormously powerful results. Dr. Tushar.
Yeah, sir, that's how, currently there are these two theories, the 5-second rule. Mel Robbins has come in her book. No? So she says that whatever you want to do, you just reverse count 5, 4, 3, 2, 1, and 0. So she learned it from the launch of a rocket.
Right.
Saw a rocket getting launched and there was reverse counting. And she says that if such a big payload can lift off planet Earth and go into space, a human being can definitely do any task by reverse counting. So like what you said, that's also a form of anchoring. You just count 5, 4, 3, 2, 1, and you just launch yourself into that zone. So what I would want my colleagues here who are present with us and people who listen to us is to listen to all this with an open mind. We are orthopedic surgeons. We really, I feel, are one of the most egoistic doctors. We have really in command. We are doers. We are operating huge cases. Many of us are doing 5, 6, 10, 11 surgeries a day, have OPDs of 100 patients, are earning mega bucks. But the truth is that we also run into problems. No matter how big we are, we require to learn this art of rapport building. It may not be just with our patients. It may be with our colleagues. It may be with our seniors, with our juniors, with our family members, with our staff, with our team members. All of us may be struggling at some point, irrespective of where we are and how we are. So today we made a humble beginning by explaining neuro-linguistic programming with the help of Amit ji and Nitika ji as to how much it has to offer us. As what I have understood from this session with him is that we've just scratched the surface. we will have to really go into details with our own personal examples and talking out with an expert like himself as to how it can help us in our day-to-day life. So hopefully, with the help of Bombay Orthopaedic Society, the big wigs are all here. Soon we may be able to organize a full day meeting or a program on this, on neuro-linguistic programming for orthopedic surgeons. And it will help us in keeping our psyche better, not just for our own benefit, but for the benefit of our patients and for our staff members and for all in general, right? So it has been such a great educational experience, Amitji, listening to you, because, I was probably thinking that I know some part of how you are going to interpret, but I also got proven wrong, and you said that it is a analytical brain that we all have and not really visual. So it's so amazing. There's so much to learn. And, there will be so many more questions. I'll request Neeraj to, this will be released on YouTube as well. So we can keep the contact numbers and email of Nitika ji and Amit ji there. And also the link of Amit ji's books, which we'll get, and we will be putting up in the YouTube link. And hopefully, Dr. Gandhi, are you still there? Yeah,
Very much there.
With some nice closing comments by our president. Sir, aap bataएं, how did you find the session and how we can sort of take it forward?
Well, it gives us an insight into what we are dealing with, how we are dealing with the patient. Sometimes we are doing it mechanically. We have been dealing with the patients many times the way we had dealt with them in our teaching days. Our teaching days, there are a lot of patients coming, there were hundreds of patients, and then we would just go ahead. I think personally, what you have given an insight is something very good. Excellent session. We've learned a lot how to deal with the patient, the body language, the kinetics, etc. So it is definitely worth it.
Right. So we got it from the big wig now that he is understood that it's a need of the hour. So Amitji, hopefully we'll keep interacting. We'll maybe at
Tushar,
some other.
Sir, I would want to end it here on a thing which I practice as a coach. So I am not, y'all are very this, but even y'all deal with people every day, and I am also a people's person. So let me end it here. There are two things which we should always be knowing. Okay. One is to ask the correct question. So what happens is when we as patients come to y'all, the questions y'all are asking us makes a very big difference. Okay. And giving y'all information, getting us information. So if I go to meet a parent, what question I am asking there? And secondly, what comes out through them. So the art of hearing and not hearing the correct information. वो लोग अपनी story बताएंगे क्या हुआ, how you have to pick up the certain points and then act on it is the two major things which I will suggest everybody, not only orthopedic surgeons, everybody in the world should be knowing the art of asking the correct question and hearing the correct information.
Yeah, and it seems that it is not organic. We feel that it is natural, but it is not natural.
Yes.
And there is a science behind it.
Yes,
so
and it is so beautiful.
Yeah, yes. And it's so great you brought out this point. I'd completely missed saying that there is a science to it. We may think we are big subject matter experts, dealing with 100 patient OPD. So we are like big communication experts. But no, there is always room for improvement. We can become better. And if we learn the science, like I said after this, but if we can learn the science, so everybody will focus on, we can learn the science.
Learn the science, yes.
Right. So I think we should end on saying that we loved the session, sir. But we will meet again soon and for a longer session. And, I am sure there will be many more enthusiastic people like me who would want to learn more from you, Amitji, to improve our practice and improve the general welfare of our patients. Because ultimately, if our patients don't do well, we can't sustain our practice for long. So they have to perceive us well and we have to do well for them.
Absolutely. Thank you very much. It's a very big subject. As I said, I have spent 23 years and I still call myself a learner.
Right.
So would be very happy to share whatever knowledge I can distribute, and I can tell you it is going to be a great asset in terms of it is, let me put it in a simple sentence, it is the difference that will make a difference in the practice. So that's what I would like to leave you with. I've just changed my signature name, so my phone number is also there in case if anyone wants to reach out.
Right. Superb. Superb. So thank you guys for joining us, and it has been a true pleasure, and hopefully we'll meet again online with these kind of webinars. Thanks a lot. Thanks a lot, everybody, for
Thank you.
Thank you very much.
Thank you very much. Thank you.